Thank you. Greetings to all dignitaries. The focus of my presentation would be on the benefits of CoWIN for policymakers and administrators. I would also elaborate upon the journey that would ensue post this conclave and how we share the CoWIN with other countries that may be interested. Yeah. Yeah, so for policymakers, achieving universal vaccination is not merely about the delivery of procured or manufactured vaccines to the people of the state. As it has been established by the esteemed speakers before me, it's a comprehensive task that is cyclical in nature. Besides inoculating people, as policymakers, we also need to constantly strategize the best media for distribution to ensure equitability and inclusivity. We need to constantly evaluate operations to reinforce these objectives and to timely do course corrections. So what do the countries need for a mass-scale vaccination campaign? The first and the foremost is the system needs to be elastic and adaptable, which can constantly incorporate changes in a very convenient manner. Constantly, we have new vaccines coming, schedules are getting revised, so we need a dynamic and elastic system. At the same time, we should have a real-time observability, meaning thereby that everything should be recorded in real-time basis. Even the vaccine center should be able to see how the vaccine sites are performing, and admin should be able to view each session's progress and which age group, which doses have been assigned, etc. The system needs to be scalable so that it can be expanded in scope. It should also be scalable at the back end so that technology can accommodate that much of traffic. The system needs to be agile and responsive so that we need to be proactive and not always reactive to stay ahead of the curve. Otherwise, we'll be doing firefighting always. We need to have an interoperable system for having a campaign of this magnitude, as we cannot force everyone to use one technology. Everyone has already existing systems, so it may be counterproductive to ask others to adopt new technology. So we need systems that are talking to each other. That is the interoperability of the systems. We should have accountability for all stakeholders in such a system so that the citizens have the confidence and there is an equitable distribution and any fraud or abuse can be potentially prevented. System which is keeping everyone true. Finally, last but not the least, we should have the system should provide for last mile connectivity. We don't have a direct link to the people who are executing the strategy. The biggest disconnect comes in execution. So this reduces the effectiveness of the system. So last mile connectivity also becomes very important. To answer the question why CoWIN, I would take a cue from the needs we just discussed and reiterate how CoWIN plugs the gaps. CoWIN addresses almost all issues which we discussed in the previous slides. First and foremost is the lightweight technology, which basically is enabled by the architecture of CoWIN. We have not constructed complex systems here. Rather, the system is simple and dynamic. Everything is parameterized. Vaccination, scheduling, age group, all of these can be easily changed, added or removed. New vaccine coming, we just have to add features of adding new vaccine without taking any much time. And we won't have to revise the schedules also. The system, CoWIN provides a very interoperable system. And also, CoWIN provides a not-for-profit public utility which is available for free to all. The system provided by CoWIN is evolvable as we are constantly getting feedback. We are constantly evolving the systems as per the requirements. The system is adaptable and inclusive for other geographies and demographies also. We have kept a system for physical and digital registrations plus multilingual system so that it can accommodate all aspects to make it more inclusive. As of now, the system is providing interface in 12 Indian languages. The system should be scalable globally, and that is relevant for the today's session also. We are providing for an open and modular technology, which was earlier geocoded, but now we have opened the accessibility to other geographies also. So we have heard these numbers numerous times today. However, going by the times we are living in, it doesn't hurt to emphasize something good repeatedly. As we can see that we achieved 200 million vaccinations in 4 months and 300 million count in 5 months. And in the course of our vaccination drive, we have even hit 3.1 billion hits on 28th of April. And in May, we hit 2.6 billion mark, and almost every day we are crossing 1 billion. And these figures have already been explained. So The CoWIN platform serves as a technological backbone of mass vaccination campaign in India. It provides a single source of truth for all stakeholders. It is formulated as a transparent system that allows tracking of each dose of vaccine supplied to the vaccination facilities and recording the fulfillment of demand at a granular level. CoWIN platform provides a personalized dashboard to vaccinators to view the performance at their facilities, ensuring accountability. And it also provides for a multilingual support for CoWIN portal and vaccine certificate. Last but not the least, the AEFI tracking is an important feature because we are able to map the adverse incidences and immediately take corrective measures. The concept of interoperability or open systems have often been shot down the world over, even before an idea was allowed to be seeded. However, in India, we have achieved this multiple times over. UPI or United Payments Interface is one such example wherein we are facilitating close to 2.7 billion transactions on a monthly basis. As highlighted before, CoWIN has been open by design. The current interest from the private sector to build on top of CoWIN is testament to this fact. So the CoWIN platform is being used through its open APIs by the state governments, by the hospitals and laboratories, travel companies, health tech companies. And so far as we can see on the slide that of the 204 applications which have come to us, already 148 platforms and applications are in the process of getting integrated with CoWIN. Next. So now that we have understood why and how CoWIN can help us in vaccination efforts, let us discuss the next steps. In its endeavor to help the world achieve universal vaccination, the Government of India is excited to share its tech backbone for vaccination with the world. For all countries interested in using this platform, we are happy to open our platform to you to further build and modify on the basis of your needs. So CoWIN is available as a public utility for the world now, which you can customize and modify as per your requirements. And I must assure all the nations that we are taking extreme care to have the best data security protocols in place, and the nation which would be accepting this would have sovereign autonomy over the systems. Finally, you would be getting full flexibility to host the system either here or on your own platform in your nation. So this flexibility would be provided to whosoever gets into collaboration with us. Over the past couple of months, we have also worked extensively to document every aspect of CoWIN. We have developed comprehensive training and support material that would help ease the transition of CoWIN in your respective countries. We are also currently in the process of training and certifying the various agencies whose services may be availed as per your convenience. So to summarize things, this is a simple 7-step process that may be followed for you to implement the CoWIN in your country. In the first step, you will have to reach out to us through the Ministry of External Affairs, Government of India. And once you show your interest, we'll arrange for a detailed demo of CoWIN platform with you. And after this step, if you are interested, we'll sign an MOU with you, and the further processes would have to be taken up by the interested country with the support of technical agencies, which we would be empaneling. So you'll be given a flexibility either to do it yourself or through the support of the technical agency, wherein the requirement detailing would happen and the development and customization as per local requirement would take place. After testing and demo, the platform would go live in your countries. Thank you. So that's it from our side. Thank you very much.
Sir, thank you for sharing the roadmap for CoWIN with all of us. Having a well-defined roadmap will definitely pave way for the easy adoption of CoWIN by the countries. I now invite Dr. Praveen Gedam, Mission Director, National Digital Health Mission and Additional Chief Executive Officer, National Health Authority, to speak about the National Digital Health Mission, India's digital health programs. Dr. Praveen Gedam, an Indian Administrative Service Officer, is currently serving as the Additional Chief Executive Officer of the National Health Authority and the Mission Director of National Digital Health Mission, a career